This week, we've spent time exploring matters of the mind and all the areas of life impacted by mental health.
Well, now we take a look at the future and what can be done to create a healthier community. Here's Bree with a look at the political momentum for the cause. Hi, Bree.
Good morning, Chris and Catherine. There are compelling reasons to seek change. Reasons like the #1 disability claim filed is for major depression. But to make mental health a national priority, some group somewhere really needs to take charge and get politically organized. One trying to do just that, the Kennedy Forum.
I mean, you can't make this up.
With all the charisma of a Kennedy, former Congressman Patrick Kennedy hosts what he calls an agenda-setting roundtable on one of the least flashy topics, mental health.
Guess what? We all have brains, and they don't always work optimally.
This Kennedy's hallmark achievement in 16 years on Capitol Hill, sponsoring mental health parity, meaning health insurance companies need to treat mental health just like they do physical health.
Well, I'm kind of like that hair club for men guy. Not only am I the sponsor of the Mental Health Parity and Addiction Act, I'm also a consumer.
A consumer who spent many years in and out of rehab, but now wants better options for the family he's built since leaving Congress.
We wouldn't imagine in this country waiting till cancer got to be stage 4 before we treated it. But with mental illness and addiction, that's common practice. It's outrageous.
For a state that fancies itself as more progressive and smarter than other states, Massachusetts is really a disgrace.
WBZ political analyst John Keller says it just might take a Kennedy to generate enough noise on Beacon Hill to prioritize prevention.
And when it comes to mental health issues, the squeaky wheel is not the mentally ill and their advocates. It's the pharmaceutical industry. It's the healthcare industry. They are big players in this state.
We can all argue about this program, that program. The key to all of this is where we prioritize our funding so as to incentivize the things that work.
Kennedy points to the private sector too, saying if smoking cessation programs work to cut tobacco use, company healthcare plans can also encourage checkups from the neck up.
That should be our approach, whether it's education, criminal justice, healthcare, early intervention. Being proactive should be where our resources go because it will offset all the costs that come from ignoring these problems until they're a real crisis.
There are a large number of mental health advocacy groups, but organizing them into a single loud message has proved problematic. So the question, Chris and Catherine, is what do we do here? Where do we set the agenda? What do we want to do first? One suggestion is perhaps primary care doctors should also screen for mental health concerns early on. So there's plenty of ideas floating around.
I find it interesting saying, like, why wait for it to get so bad for us to then
do someone to be in jail or for someone to end up with post-traumatic stress disorder when you know that if you help them unpack their bags early, you know, you can kind of prevent it from happening.
One of the things earlier in the week we were talking about was the first responders.
Yeah. And
I know we were talking about this earlier too, is another idea possibly training all first responders to recognize signs?
To recognize signs and also to de-escalate situations. So some of these confrontations that get more violent don't have to end that way because police can recognize it and respond appropriately and get them the right care. So lots of ideas, matter of how do we get there.
We've had quite a week in this series.
Lots to talk about.
Yes, very much so.
Very important topic. Thank you very much.